Hello, this is Saba again with Rejuvenate with Saba on Amber Dazzle Show. So today I thought I'm going to share my story with you and how did I discover about a lot of things that I practice. So a few years back I tried to understand what was going on with my body and what changes were happening. I started feeling tired and fatigued, and I was feeling like I'm forgetful, I'm not remembering things, and I was having difficulty sleeping and the energy level. And as a physician, I have to work for late hours as well, and I was not able to cope up with that. And I was feeling like I was not productive at work as well. So I thought, let's look at my blood levels and then see what is wrong with me. And I checked my hormone levels and I checked my vitamin levels, and sure enough, I was deficient. I was low in iron, I was low in vitamin D, and I was low in B12. So basically, I realized that these things are low. According to the lab values, my levels were within the normal limit, but actually I was not feeling even good. So I thought I'm going to replace. I start taking the vitamins. So start taking the vitamin D and start taking B12, start taking folate and iron, and sure enough, I started feeling much better than I was before. It took me a few weeks to months, but it started feeling much better. So that's how I learned about what vitamins can do to your body. Vitamin D, let's talk about the vitamin D. Very common vitamin, sunshine vitamin, people talk about it. Vitamin D level, number one, it has to be more than 70 in order to make you feel better, in order to give you energy and protect you from a lot of infections and viruses. A lot of times the over-the-counter vitamin supplements are not good enough. They don't absorb very well, and actually they do not raise your level to a certain extent what it should be. Iron deficiency is very, very common in men as well as in women, but in women it's actually worse because you lose vitamin with the monthly blood loss. In women it's very, very common. And so iron deficiency can cause shortness of breath, difficulty breathing, and of course headaches and migraines and extreme fatigue. Replacing iron is amazing. It makes you feel better, it gives you more energy, you think better, your mood gets better, as well as you have more energy. Vitamin D, iron, as well as now the B12 and folate. Let's talk about that. They're like brother and sister to each other. They are essential in the brain and the nerve and the heart functioning. And low B12 and folate can actually cause nerve damages and nerve dysfunctions and neuropathy and the numbness in the feet and the numbness in the hands. And a lot of times just replacing a good quality B12 and folate can actually help feeling better. So another important question, what vitamins should you take? There are so many vitamins over the counter. Vitamin D, good quality vitamin D, 5,000 units every day with food. Do not take it without food. B12, you should have at least 1,000 to 2,000 micrograms of a good quality B12. I insist on good quality because not all vitamin Ds or Bs or folate will be equal. Iron bisglycinate and iron ferrous gluconate, they are extremely good and they do not cause stomach problems, and you should take at least 1 to 2 tablets every day, especially in women who lose iron through the blood loss during their periods, as well as calcium, at least 500 international units every day. This is all for today, and I'll bring you next topic next week. Thank you for watching.